Let me first of all start by saying that the COVID-19 pandemic continues to preclude us from meeting in person. We must therefore operate by this virtual manner. And just to remind the public that at the beginning of the meeting, the council staff will read the agenda for today's meeting in its entirety. That agenda is also online at council.nola.gov. Anyone wishing to comment on any agenda item should go to council.nola.gov and fill out an online public comment form. Only written public comments will be accepted. Public comment will be limited to one comment per person per item, and the comments should be limited to 2 minutes when read aloud and be germane to the agenda item at hand. The public comment will close at the end of the 10-minute public comment period. This will be announced and no written comments will be accepted after that. Before voting on any agenda item, the council staff will read any public comment received for that pending item. So with that, Paul, may we please have a roll call?
Councilmember Banks, Chair, present. Councilmember Moreno.
Present.
Councilmember Gisselson Palmer. Councilmember Brosette. Councilmember Nguyen.
Present.
We have 4 members and a quorum.
Thank you all. Paul, if you would please read the agenda.
The agenda for the March 3rd Community Development Committee meeting is as follows. 1, roll call. 2, approval of the minutes from the February 9th, 2021 meeting. 3, COVID-19 vaccinations updates. Presenter Jennifer Avegno, Director, City of New Orleans Health Department. 4, Training Grounds Incorporated brief. A presentation on programs and workshops that are specifically geared for parents, caregivers, and educators, focusing on the years of birth to age 5. Presenter Melanie Richardson, co-founder, executive director of Training Grounds Incorporated. 5, grass cutting ordinance. Ordinance calendar number 33,244, amendments to chapter 26, lowering the height for grass and weeds violations to maintain consistency with chapter 66,213. Presenter Shay Zeller, director of special programs for the Office of Business and External Services. 6, private security patrols. Licensing and oversight of neighborhood and local private security patrols. Presenter Fabian Blasch III, Executive Director of the State Board of Private Security Adjusters. Item 7, adjournment.
Thank you. If we could, can I get a motion to approve the minutes from the February 9th meeting?
So moved.
And second, please. Roll call. All in favor of approving them?
Aye.
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 Thank you. So with that, the minutes are approved and we will proceed to the 10-minute recess. And after the 10-minute recess for public comment, we will introduce Dr. Avegno relative to the COVID-19 vaccination efforts. So Paul, what time are we due back?
We'll be back at 10:14.
10:14. Thank you so much. See you all then. Okay, folks, it is now 10:14. We are back in session, and we have had the required public comment period. So with that, we will move on with the agenda. Dr. Avegno, good morning. How are you?
Good morning.
If you would, please give us an update on the COVID-19 vaccination efforts. For information, please, ma'am.
Absolutely. And it's a great day to do it. As you might have heard, the mass vaccination site at the convention center is having its soft open today. So it's going really smoothly, but I'll get into that in a second. Let me just start by saying that while we are really excited to have 3 approved vaccines now in our armament, COVID is far from over. We are over 27,000 cases, over 710 deaths. We, still have, although our numbers have improved significantly, we have great concerns about the virus variants that are out there. We know that in Louisiana, over 50% of the confirmed B.1.1.7 variants are in the New Orleans region. And just as recently as a few days ago, the CDC director urged state and local municipalities not to ease restrictions because of the concern about variants. Unfortunately, some of our neighbors have decided to do just that, but I just want to, have people understand we are in no way out of the woods. The vaccines, though, are our way out, and we are making progress. Right now, per the state, those who are eligible for vaccine are ages 65 and older with any condition, and ages 55 to 64 with CDC conditions that put them at high risk. Also included are educators, our law enforcement personnel, daycare centers, and the healthcare workers that have been vaccinated since the beginning. We do not have parish-specific data on vaccinations, although I am told that we will begin to get that publicly this week, which will be very excited. We do have regional data, and for Region 1, we currently lead the state in the percentage of individuals who have received at least one shot. As of today, that's 16.7% of all individuals in Region 1 have received at least one shot. That actually jumped 2 percentage points from last week. We expect it to jump again when the state reports more figures tomorrow. This is all available on the LDH website. So while 16.7% is great, it's nowhere near the 75% that we need to get to full immunity. I'm very encouraged by what's happening with our educators. I was told yesterday that all of Orleans public school teachers will likely be finished with their first shot by next week, which is fantastic since we just started vaccinating them last week. And I've heard the same from Jefferson Parish. I've heard the same from the private schools. So our teachers are really showing up and able to get their shots. As I said, we now have 3 FDA approved vaccines, the Pfizer and the Moderna that have been out since December, that are a 2-shot series. And as of this past weekend, we now have Johnson & Johnson. And so I just want to spend a second talking about that. Public health experts agree. Any shot you can get is the right one for you. They are all incredibly effective. They are a little different. Pfizer and Moderna are very similar in the way they were developed. Johnson & Johnson is a slightly different type of vaccine, but it is one that has been used previously for other diseases and proven to be very, very safe. Johnson & Johnson was tested in many different countries, and including the US, and it was tested during the height of our recent surge. So we saw how it performed when a lot of people were getting sick, and that's a really good way to test a vaccine. It is about 72% effective in preventing symptomatic COVID, which is really good for a vaccine. It is 100% effective in preventing deaths from COVID. And that is the number that we should care about. It is also 85% effective at preventing hospitalizations and severe disease. That also is tremendous. So while don't get too fooled trying to compare numbers between vaccines, it's sort of apples to orange, but the takeaway is all of them are incredibly effective. Johnson & Johnson has some other advantages in that it is just one dose and you're done. There do seem to be fewer side effects after Johnson & Johnson. I know a lot of people have had side effects after Pfizer or Moderna that, although they go away quickly, can kind of leave people dragged out for a day or so. So from the trial, we don't see that quite as much. If anyone would like to know what it feels like to take Johnson & Johnson, one of our team members here at the city was in the clinical trial, found out just recently he had actually received the vaccine and is on ready.nola.gov talking about the Johnson & Johnson vaccine. He had a great experience with it, really very few side effects. So this one dose, it's easy to refrigerate as well. It lasts longer. So logistically, it's a lot easier. So this is approved for everyone. As I've told my family, my friends, get the one that's there. If it's Johnson & Johnson, line up and go sleeves up NOLA. That leads us to, who's vaccinating. Every week, LDH posts a list of where you can find vaccine in your parish. They continue to do a really good job pushing out not only to the healthcare systems, but to clinics, FQHCs, local pharmacies. And we at the health department receive our allocation as well. The mass vaccination site that's opening today in Orleans will be at the convention center. It will not be every day quite yet. The only issue with the Johnson & Johnson supply is that although we're getting doses this week, it's going to be a little inconsistent for a few weeks, and then we expect to receive regular doses. So while we hope to have the mass site open every day, we're still kind of waiting to see how it's going to shake out with the allocation. But it is open. People can either sign up for our wait list by calling 311 or go to ready.nola.gov/getvaccine and signing yourself up. If you are eligible, we will get that list to the LCMC schedulers really within hours, and they will call you to schedule. You can also call LCMC directly, 504-290-5200, and make an appointment. There are going to be lots of doses this week, so we encourage people who are eligible to come out. There is free parking at the convention center in Lot F. Our partners at RTA are setting up free shuttles to 3 major hubs so that people can get to their vaccine appointment for free and back, which is really exciting. And so we don't want there to be any barriers. We continue to host community events. Today we are at the Cutoff Rec Center, vaccinating a lot of folks in Algiers. Tomorrow we will be doing musicians and culture bearers who meet the criteria at the Ashe Cultural Center, which everybody is really excited about. We are working with, we did faith leaders last week. We are working with our Hispanic task force to do an event geared toward the Hispanic community in the next 2 weeks. We're still, the allocation of vaccine is not nearly what we want it to be, and that's true all over the country. But we are not wasting any doses. We are making sure every single one goes to arms. There's other mass events happening in Jefferson Parish at the Ilaria Center and Airline, so folks who live closer to there. And I know other smaller parishes are doing them as well. The bottom line is sign up. Even if you're not eligible yet, we have really been encouraging the state to expand eligibility criteria as soon as possible. We don't exactly know what that will be. We don't know if they're going to expand to different types of workers as they had initially planned, or if they will expand to younger ages who have particular medical conditions. But what we know is that we've got a lot of folks who don't quite meet the criteria, but are eager to get on the list. We continue to do a lot of outreach. We know there are folks that are still hesitant and have questions. In partnership with Resilience Force, there are community health workers going door to door in community hubs, talking to people, putting out flyers, just sort of hearing questions, educating them, and we'll have the ability to sign them up on the spot for vaccines if they are interested. We hope to expand that program, and our Sleeves Up NOLA campaign is everywhere and hopefully more. So that's what I've got right now, Councilman, if there are any questions.
Doc, just a few, please. Are we on target where we expect it to be in terms of the percentage of the population that so far has been vaccinated? Are we in front of where we want it to be, behind it? How we doing?
I think so. I think we are using every dose that comes to us. No one is wasting doses. We are filling appointments every week. So we certainly aren't lagging behind. I know in other states, they're really not having people sign up that quickly. I don't understand that here. Here, I think the demand is very strong. And I think once we can get regular allocations of Johnson & Johnson, you're going to see that percentage go up really high.
Is the racial disparity that's been talked about in the national news, is that prevalent here, or are we different, or are we having that same reluctance with people of color?
So that is something that we are really focused on in terms of education and understanding why there might be hesitance. I will say that, I don't have visibility yet on overall what do the demographics look like in Orleans Parish. I've asked the state, please, can we understand the racial breakdown? And they've assured me that that's coming. I will tell you that of our sites, of the sites where the health department has planned and scheduled and gotten people off the wait list and really been in community, worked with our community partners very, very closely, I'm really proud to say that our sites look like New Orleans. The demographic, every time I run the demographics, it breaks down pretty much exactly as 60% Black, about 30% white. We do need to get better data on our Hispanic population. We're getting them in, but they're a little bit difficult to capture. And our Vietnamese population as well, for Councilmember Nguyen, we're getting them as well. We use our wait list to really figure out who's not signing up so we can target outreach. We can get to where we need to go, get their questions heard. It's a lot of hard work when you simply just say, well, go online and you'll get an appointment and it's somewhere you've got to drive to. That doesn't work for a lot of people. And that just sort of replicates systemic inequities in digital access and other types of access. So that's why we have to have multiple events in multiple places, getting as many people as we can.
And Doc, I want you to reemphasize and drive home that there is no better vaccine. Whichever one that's available to you is the one you need to get. So I'm getting calls about folks telling me, I don't want to take the X because I heard the Y was better. But can you just expound on that a little bit more?
Yeah, look, I have listened to a whole lot of public health folks talk about this. I've personally read through every one of the documents about each vaccine because I needed to understand how they worked or didn't work. Just like there are 10 different hypertension medicines that your doctor might put you on, right? They all are a little different, but they all have the same effect of lowering your blood pressure, right? So all of these vaccines are incredibly effective with, minimal side effects or side effects that aren't that severe. And none of them had any safety concerns that were significant in clinical trials. So really, it is a gift to have these three. If you told me a year ago we would be at this place, I wouldn't have believed you.
And Doc, we've got the vaccines. The governor has reduced or relaxed the restrictions. The other parishes have pretty much so done the same. What can and can't be done in all these parishes now?
So as you know, we just relaxed our own restrictions to increase gathering sizes to 75, 150, which was a big jump from where they were. And we really do need to see what the effect of that is going to be. We just got the information about the governor's restrictions yesterday, so we're really going through them with a fine-tooth comb. We are doing well. We are doing better. So, it is likely that we can recommend to the mayor that we can adopt some of what the governor is recommending. However, we do face an increased burden in Orleans because we know that the variants are out there. If they're going to be prevalent in any area, it's going to be in a dense population center like ours. So we do not want to get into the point where we relax so much and they're here and they take over. That's why the CDC came out very strongly and said, now is not the time to let up. We're not 16.7% is nowhere near the amount of immunity we need to be to really relax restrictions. So I'm hopeful that we can, move in line with the state with those restrictions that make sense and protect our folks. But we're going to be looking to see, what the effect of our recent change has been before we do that.
And for residents who do not have internet capabilities, how do they register, or how do they get in line to be able to get a vaccine? Is there on-site registration? What's the process for them?
So all of the vaccine sites are appointment only, and that makes sense because what we don't want is massive crowds of people showing up and then not, having it be chaotic. That has not worked in other places. The easiest way, call 311. If you are Spanish speaking, you can ask to speak to someone who speaks Spanish to help walk you through. They will go through all the criteria with you, check your information, and put you on our wait list, which again, our wait list is being shared with a lot of providers around the city. It's not just LCMC. Ochsner is using our wait list. Tulane is using our wait list. We've got thousands of people in places all over the place. So we will get you scheduled. If you specifically want to go to the convention center, LCMC has the hotline that I mentioned. So you can call them as well. But really calling 311 if you're in Orleans Parish is the easiest way to go.
And then my last question. Talk about testing. I know that the National Guard, their last day is Saturday, but please, is testing still important? And then how do folks go about getting tested?
It is. It is still important, and it is still going to be available in a number of different locations. But we've seen a drop off in testing, and that's not a New Orleans thing. That's happening all over the country. It's happened before when numbers are good, and if people are generally following the rules and they think, well, I'm good, I don't need to get tested, I feel okay. When we have surges, that's when we see a lot of people with testing. When we started community testing in April with LCMC, we were the only game in town. There were not that many places to go. Now, there are clinics, the hospital systems are still doing it. It's super easy. I got my kids tested a couple of weeks ago at one of the local hospitals. Couldn't have been easier. We have urgent cares doing it. We still have community partners like CORE doing it. We're doing it in schools, so kids and staff have opportunity right there. So there's plenty of places to do it. If we see that all of a sudden the need is there, the demand is there, we can easily pivot to reopening testing sites. But there's a lot more options now, and they'll continue to be on our website on ready.nola.gov. You can continue to see what's available in your area every day.
Okay. Colleagues, and Paul, would you please note the Vice President, Councilmember Glapion has joined us also. Council President, I see you waving.
Thank you, Mr. Chair. Good morning, Dr. Avegno. My question, I have a few questions. First, on the variants, can you give me that statistic again? You said more than 50% of the cases are in New Orleans. Is that right?
Right. So what we know from the state is the confirmed cases that we have so far, and I believe there are 18 of them that are confirmed B117. And, the process of confirmation is a bit of a lengthy one, so you're always kind of playing catch up. But of those 18 confirmed cases that the last I checked, 10 of them were in Region 1, so the New Orleans region. And generally that means, the core center. Again, it makes sense. We have more people. When you have more people, the risk of having a variant is higher.
And which variants are we seeing?
So this is exclusively the B117, which is the UK variant. So far, we have not seen either the Brazilian or the South African or these sort of new New York and California variants that nobody really knows a lot about. The problem is, we don't have really good ways to rapidly test for them. And so while the CDC is really increasing their surveillance testing for this, we could be missing a lot. This could be just the tip of the iceberg.
Gotcha. On the vaccine piece, is there some type of projection where, there will be a time when anyone who wants a vaccine will be able to get it? Is there a projection on when that could happen?
Well, the president came out yesterday. You might have seen and announced a deal between Merck and Johnson & Johnson. So two rivals actually making the same product. And what they estimate that will do is any adult who wants one by the end of May should be able to get one. So my 18-year-old son was really excited about this when he heard about this today. I really believe that's possible. And I think that's a goal we should shoot for. What I worry about is that, if we need to get to about 75% to reach immunity, what happens when we stall out about 50 or 60%? I think that last mile of really educating people and doing outreach and making sure they feel safe so we can get to that finish line, that's what I'm concerned about. But, we've already begun that work. We're not going to let that work up, because I would like for New Orleans to be the first city to get to 75%, at least with our adults.
I'm right there with you, and I'm happy to do whatever it takes to help you achieve that. So if it's possible that by the end of May, anyone who wants a vaccine hopefully will be able to get one, are we going to be prepared, Dr. Avagno, to be able to do the community sites, canvassing, transportation, all the different things that we've been talking about? Is that timeline? It's not that far away. Are we going to be able to meet those demands?
I hope so. There's always more that we could be doing, certainly on the outreach piece. And we've been having good conversations with philanthropic organizations, for example, just to help us support additional community health workers, additional forms of communications, media, advertising, education. We could always use more folks on the ground and more ways to get the word out.
Mm-hmm. Okay. Well, just let us know what we need to do. And, we're ready,
we all are
for this to be over. So whatever it takes to get us to our 75%, count us in. So thank you, Dr. Avagno. Thank you, Mr. Chairman.
Thank you, Council President. Councilmember Nguyen.
Yes, thank you, Mr. Chair. And Dr. Avagno, first of all, I just want to thank you and your team for all the hard work. I know that I've been in communication with you guys on different strategies of really getting people to get out there to get the vaccine. But I wanted to ask you a question. So I'm not in the healthcare field. So taking the vaccine, does that protect one from the variants?
That is a great question. And the short answer is we believe so for the most part. We don't know as much about how Pfizer and Moderna work against the variants because they were tested at a time when the variants weren't there. What we're seeing is that they likely do have some protection, but just like Johnson & Johnson, maybe it's not that 95%, right? Even so, the point is the more people we get vaccinated, the fewer chances the virus has to mutate to a new variant or to replicate and keep spreading. So it's really a race against the variants. If we can get enough shots into arms, then the variants have nowhere to go. And regardless if they're more transmissible or more deadly, they're going to really die out because there's just no one left to infect and no one left to spread it around. So, I think most public health experts are really worried about the South African variant. That seems to be more deadly and more concerning. Again, knock on wood, we haven't seen it in the US yet. So that's why we need to get everybody vaccinated before it has a chance to take hold.
Got it. And so, and I appreciate that explanation. I think that share with the public to let people know that are watching that taking the vaccine is really critical about getting the city reopened, but really protecting yourself from future variants as well, because we don't want to lose any more people in our community at all. But just on the conversation around, are we going to be able to have enough site, if the vaccine is available by the end of May, to ensure that every adult have access to it? I know that District E, we stand with you guys to assist in any way. I know we've been talking to a lot of our churches to open up their location and be prepared. But I just wanted to let you know that really appreciate all the hard work. You guys have been really innovative and creative in reaching out and making sure that residents who are registered with the 311, and I want to encourage people as well to register with the 311 because I know I get calls like, there's 20,000 numbers to call, there's 20,000 lists, and people get really frustrated. I want them to know that don't get frustrated, just, get yourself on a list. And I know we're working closely with your office to make sure that resident that gets on the 311 list that are eligible, and that when we have vaccine available, that we're getting them to the vaccine, so in that way they can protect themselves. So again, thank you very much for all the work that you guys been doing.
Well, thank you. And that was a great example. When y'all were having big event in New Orleans East, we were able to easily pull all the residents in the nearby areas in District E who were on our wait list, gave it to y'all, and you all were able to knock it out. So it really, we want to prioritize people having access in their own community, because that's the way we're going to make it as easy as possible.
Yep, appreciate it.
Colleagues,
I have one question.
Kristen, Councilmember Palmer.
Thank you. Dr. Vegna, thanks again. We're really excited that you're over here in Algiers, and we're really pleased to give you that list. And I think that's going to go a long way. But I have to tell you, after y'all have proven yourselves continuously on how to do the testing, it really makes a lot, I know y'all are going to go right back into the communities. And I think you've already set up the template for how successful that's going to be. So I just want to thank you. I kind of want to get back to the different regulations for reopening and how we may or may not be different from the governors. I know you said you're still in the process of weeding through that. Does the fact that you found more variants in New Orleans, is that also going to play into, like Councilmember Moreno just brought up, is that going to also play into how open New Orleans is going to be?
Yeah, because the thing about the variants, particularly the UK, which we know probably the best, is that it is more transmissible. So what that means, again, the virus hasn't changed the way it's transmitting to other people. So close crowds of people who are gathering is how it transmits. So if it's more transmissible, then the more crowds, right, are going to be that much worse. So it's the same principle as we've looked at before, whereas events that are types of activities that are fixed and seated, and where you are just with your people and you are not mingling and gathering and being close and all that, those tend to have been safe and are continuing to be safe, because the virus just although it can be transmitted, it's not quite as well. So for example, we are at 50% for most of our sectors. The governor went to 75% on a lot of those kinds of activities. It probably makes sense for us to recommend to the mayor that we do go to 75%. However, we just increased
75%, like 75% to our restaurants.
Of all the things that were 50%. Although gyms were kept at 50%, and that's because there's really good evidence that just came out from CDC that gyms are riskier and the risk of transmission. So again, using the science to sort of inform the decisions, but just having increased our gathering sizes, I think, and knowing that those are generally the more dangerous ways that the virus spreads, helps us say maybe that's not the best idea. That's probably a really risky thing, is to then go up even further in the gathering sizes while we know those variants, those highly transmissible variants, are out there.
Okay. All right. Cause I think we're just going to have to be, because I think saying that dense cities, we might have to be different than other cities. I think there's going to be an argument around the state while Baton Rouge has the same population. I think we're just going to have to be very clear,
Right.
And obviously we know New Orleans is different on many ways, especially when we talk about large gatherings. And that's kind of what a lot of folks, what we do here, but we're just going to have to be, I think, really clear when we come out to why.
Absolutely.
Thank you so much.
Councilmember Glapion.
Thank you, Chair. Doc, I have a question, because at this stage, we have folks that have been vaccinated. We have folks that have stayed safe the entire time, folks that have survived contracting COVID-19. Can you reinforce for us, if you've gotten the vaccine, do you still need to wear a mask, social distance? And if you've gotten both doses, do you still need to wear a mask and social distance? And if you've recovered, do you still need to get the vaccine?
So the answer to all of those is yes. And that is, but I really appreciate you giving me the opportunity to speak to that a little bit. So yes, so 16% of us, myself included, have gotten the vaccine. I'm still wearing a mask. I'm not changing anything that I do because I'm the only one in my house that's gotten the vaccine. We don't know yet. We're starting to see evidence that if I've been fully vaccinated, I'm less likely to get a mild case that I won't even feel and transmit it to others, but I still can. I don't want to put my husband at risk if I don't have to. So we do still have to continue to wear masks and distance. And if you've gotten COVID, we really don't know how long that natural immunity lasts. We have seen, I'm a physician, I have seen it personally and heard a lot of cases of people who got COVID twice. And the second time was not any prettier than the first. In fact, it was worse. So we know that natural immunity is not sufficient to protect you. We think that even if you've had COVID, adding the vaccine is going to make you really, really protected. But until that critical mass of us all are vaccinated, then in order to protect the ones we love, we have to keep wearing a mask and we have to keep distancing.
Great, thank you.
Colleagues, any other questions?
Yeah, Jay, can I just follow up? So Dr. Vecno, and I know we're trying to get people to get vaccinated with the COVID-19. Has there been any discussion with CDC and the health community in reference to, do we see this happening annually where like the flu shot?
Yeah, that's a great question. And they're trying to figure that out right now because again, we just don't have enough time to know, is the immunity going to wane? That's why you get a flu shot every year, is because it's a different strain and your immunity isn't 100% one year to the next. My gut, and it's just a gut, is that yes, we probably will have to get some kind of booster, whether that's yearly like a flu shot, whether it's every few years is still to be determined. But what we have to do now is tamp this down to where it is a very low level. If we can get the rates of coronavirus like the flu, then we can deal with it, right? Then we can figure out, okay, yeah, we got to get a shot every year, every 2 years, whatever. But until we get to that point, we're not really going to know.
All right, thank you. Thank you, Mr. Chair.
Colleagues, any other questions? Well, Doc, I've just got one more. And I know that at some point we will get to the point of having the vaccines in neighborhoods. So do we have a timeline? I've got St. Peter's Baptist Church up in Gertown and the New Zion Baptist Church over on 3rd Street and Little Saint over on Martin Luther King and the Drives YMCA. I got folks calling me every day offering facilities that want to be able to help in this effort. I think that is one of the most magical things about New Orleans. When people see a problem, they want to step up to try to remedy it. So we've got these sites that are ready and willing to be able to be used. So what's the timeline before we can actually start getting into neighborhoods?
So we're already there. We started at Alley May in Central City. Ochsner went to Franklin Avenue Baptist. Tomorrow we'll be at Ashe. We're trying to get there as quickly as we can. So keep sending me your list. As you know, we're planning to go to Zulu, which will be incredibly fun, I hope. It's a little more tricky to do it than just to set up a testing site. And we're, again, trying very hard to hit every single neighborhood. But, you send me your list, Councilmember Palmer sent her list, Councilmember Nguyen sent her list, and we'll just keep going through them as quickly as we possibly can.
Well, I'm glad that Zulu made the cut, but we've got these other folks and my list is growing. So since I've spoken with you last, I've got several other requests. And even if those sites cannot be vaccination sites, if we're going to continue testing or have neighborhood testing or have testing available, those folks are willing to participate in whatever way they can to be able to spread the word and to get folks inoculated and keep people safe. As horrible as this thing is, we're very excited about the vaccines and where we are, but it is far from over. I am dealing right now with my chief of staff is going to have to be doing this meeting and others virtually because she has been exposed and we don't know what that is. So by no means should anyone feel comfortable that we are through this. We are in it, but we are far from through it. So Doc,
Yes, sir.
thank you. And I'm sorry, Councilmember Brissett, you joined. Did you have a question? Okay. All right. Doc, thank you so much. And we look forward to seeing you next month with updates, and let us know how we can help.
Great. Thank you all.
Take care. Bye-bye. All righty. We had no public comments on that matter, so we're going to move on to introduce Melanie Richardson. And this is presenting programs and workshops that are specifically geared for parents, caregivers, and educators dealing with young children. Education is something that we cannot ever dilute the value of, and it is imperative to all of the efforts that we're doing from crime to economics to housing to everything else that we're involved with. I think that the central crux of that begins with education, and I think we can allay many of the ills that face our community if we buck up our education system. So we're going to keep trying to press this to get folks to understand how important this is. So with that, Ms. Richardson, welcome. And
Thank you. I'm going to go ahead and share my screen with you, so those of you that are watching via video can actually see the PowerPoint. And I'm going to share. So thank you so much, Councilman Banks, for providing me with an opportunity to speak to everyone today about training grounds and the services that we provide. My name is Melanie Richardson, and I am the co-founder and executive director of Training Grounds, which is a New Orleans-based nonprofit organization that was founded in 2016 to assist parents, caregivers, and early childhood educators with improving education and health outcomes for children birth to 5. When we started this program in 2016, every state and federally funded program that served children birth to 5, well, birth to 3 had a waiting list. And we know that birth to 3 is the most critical time for brain development. And so we started Training Grounds to help and assist with those efforts. Since then, what we have seen is that City Seats Project has been added to address some of the numbers. But in 2019, the Orleans Parish School Board Early Childhood Education suggested it would take $200 million per year, 5 times the amount that we currently invest for every child under the age of 5 to have access. We know that that is extremely ambitious, and as we continue to work to identify funding streams, we know that we have to still provide some type of service to families. Research has shown from the Harvard Center for Developing Child and the Heckman equation that early childhood benefits not only children and families, but it also impacts school systems and cities. And just like Councilman Banks mentioned, we know that it affects graduation rates, it affects crime, it affects employability, and all of those things that are down the line. So I will actually share with you a video now to introduce you to Training Grounds, and you can see some of the activities that takes place in our Replay Center.
In the first 5 years of a child's life, 90% of their brain is formed. Training Grounds is here to help support that and help make sure that all those children have the best brain building activities, learning experiences during those first 5 years of life so that they can set the foundation for their future success. Right now, 4 out of 5 children from low-income families do not have access to a Head Start space.
We realized that parents needed help understanding their early child development. We started Training Grounds to address the needs to help parents, caregivers, and educators understand ages and stages of development and things that they could do to help improve early childhood outcomes.
Training Grounds provides the We Play Center, which is a free play space for caregivers and children ages birth to 3. We also do professional development for early childhood professionals, and we provide workshops for parents and caregivers.
And it's important that we provide all 3 so that we're sending a consistent message to everyone that's influencing children or that's involved in the lives of children. 97% of the adults that utilize the We Play Center are either grandmothers, mothers, or aunts, which is interesting because 97% of the professionals that are in early child care are women as well. So when we go out to the community to do workshops, we're working with a large number of women who are also mothers and grandmothers and aunts who are influencing not only the children in their classroom, but their families at home as well.
Parents have a choice on what they do with their children every day, and the majority of parents return to the We Play Center for multiple visits.
I am passionate about the work we do because I'm from New Orleans. This is home, and I know that the only way that the city is going to improve is if we do a better job in starting from the foundation and starting from 0 to 5.
The next level for Training Grounds is scalability.
Ultimately, we would like Training Grounds to be a hub for all things 0 to 5, a place, a location, a trusted source that families can come to whenever they have questions or concerns about children. And we want the We Play Centers to be in every neighborhood and every community, not just in New Orleans, but throughout the state of Louisiana and throughout the nation. The problems and issues that we're having in New Orleans with 0 to 5 and access is not unique to New Orleans. And so this is something that could be truly beneficial.
I was a teacher for 20 years. I'm in classrooms working with teachers all the time. And you want what's best for the next generation of children in the city to just be able to do well.
Here we go.
So thank you. And that just kind of gave a little bit of a picture about the center. And we really serve those families who do not have access to early child care centers, either because there's a wait list or we don't have enough seats, or parents who have chosen to actually keep their children at home. All of our We Play programming is evidence informed and uses the most recent research on brain development, brain science, and parent-child attachment and bonding. Since COVID, we have had to move many of our programs to virtual. So we offer daily virtual sing and dance that actually builds language skills, cognitive skills, as well as social emotional skills. We have created a Let's Play and Talk session where parents can register for a one-on-one session, play session with a parent educator, where we conduct CDC developmental screening so that if we do need to act early and intervene, we can send those families to the appropriate resources. We started that in December, and actually every one of our Let's Play and Talk sessions have been filled for the last 3 months. We do virtual online activities for parents centered around brain science, understanding ages and stages, on potty training, on positive discipline. So we do a variety. We do Hug Your Baby is also another one of our programs that is designed for mothers that are in their 3rd trimester or have children under 4 months, to help them to understand their baby's body language in order to promote breastfeeding and to prevent and solve problems around eating, sleeping, crying, and parent-child relationships. And so we also have a lactation consultant on staff at the We Play Center to help promote breastfeeding and to help parents as they struggle through that process. We have our We Play Gets Ready for School program, and we'll talk a little bit more about that later. As you can see, we actually touch just about every zip code in this Orleans area. We also draw from other parishes as well. 69% of our families identify as African American, Hispanic, and Asian, and we are really making certain that our We Play Center is reflective of the city of New Orleans and our attendance and population. 75% of our families report annual income less than $30,000 a year. We have had the opportunity to serve families who are living in homeless shelters through families that are making over 6 figures. We are truly a location where it is for all families to come together and engage with their children. As you see, in addition to providing parents and caregiver support and building a solid foundation for children, the We Play Center creates a sense of community for its members. Because we're drawing such a diverse group, people are able to engage in discussions and talk about what they see and want for the children of New Orleans. And it doesn't matter your demographic, your ethnic background, we all want the best for our children. And this is a place where parents realize and learn from each other and with each other. Parents, educators are on the floor constantly modeling appropriate interactions, helping parents to better understand child development. We are making certain that our children are meeting the developmental milestones. And in those cases when they are not, we are referring to early steps, child search, pediatrics, pediatricians to make certain that we act early. Many of our families will not be seen by school officials until they enter kindergarten. And we know the longer we wait to respond, the more challenging it is for them to meet those developments. So we really want the We Play Center to be that hub of resources for all things birth to 5. And last year, we actually, even during a pandemic, still reached 1,150 adults and children. And I think that that speaks to our ability to build community, to connect with families, and to be able to respond to their needs. So when everyone else was trying to figure out what we're going to do with children and schools were closing, we immediately had town hall meetings and we were able to answer questions and provide information and resources for our families, actually 1 week after we had to close our doors in March. So we've been operating virtually. We understand that kindergartners in Louisiana generally enter underprepared. And so what we quickly did last year was create We Play Gets Ready for School. And all those rising kindergartens and pre-K students whose years were interrupted but were going to be expected to enter into kindergarten ready to learn were able to quickly participate in our We Play Gets Ready for School program. They had the opportunity to participate in story time, art activities, STEM activities, virtual play dates, all around developing those social emotional skills and executive functioning skills successful for school. They received a backpack with all the materials in it. We had virtual support as well, but it was also important for us to address the digital divide. Any child that may not have had access to an internet was still able to follow along with the activity guide that was given to their parents, and they were able to successfully complete the program either virtually or at their own pace. So these are just a few pictures of the smiling faces and the children hard at work, actually engaging. We were fortunate to actually partner with a charter school management organization and served 3 of their elementary schools. And these are the DIBEL results from the last summer. Children who participated in We Play Gets Ready for School, we see that they came in at tier 1 at a higher rate, as well as tier 2. And we also saw fewer of the children in We Play Gets Ready for School coming in needing intensive care. And guys, that was after a 5-week program. Now we know it's not causal, but we do know that these are early indicators that this program is successful and definitely can help with preparing our little ones for what they need to enter school. So 40% of Louisiana students entering, we know that we have to continue to work. Without access to quality early learning programs, our children and our community are at risk. We as a city do not have enough money to provide every child a seat in an early learning center. So we have to be bold in our solutions. We have to be willing to think outside the box. And the We Play Center and our programming actually does that for a very low cost, but very effective programming. So as you see, once again, these are just some of the demographics. 60% of our participants return for multiple sessions. Families, 92% report feeling supported in their role. 94% say they have a better understanding of what their children need. And so we know that this is working. Our children enter into school. Teachers are thinking that they have been exposed to early childcare learning programs because they come prepared to learn. We are funded through grants, private donations, and we do generate revenue through our fee-for-service programming. We have a ton of partners that we've been working with, but we know that there's a lot more that we can do and we need to be doing to service those families that do not have access. We are in the process of raising $100,000 that will allow us to expand our We Play Gets Ready for School program and to keep the doors of our We Play Center open, either for private sessions while we're still addressing and dealing with COVID. And it is our hope that we'll be able to open for full play sessions where we can have our 30 or 40 families in the center playing together really soon. But we are continuing to reach the numbers that we had originally set out. So we know that $100,000 would allow us to serve 200 We Play Gets Ready for School students this summer and allow about 150 families to utilize the We Play Center for the remainder of 2021. So I really appreciate the opportunity to present to you today about training grounds and the We Play Center. If you're interested to learn more, you can visit our website at www.mytraininggrounds.com, or you can follow us on social media at MyTGNOLA. So at MyTGNOLA on Facebook, Instagram, and Twitter. So at this time, I want to open it up for any questions that anyone might have, or any clarity that you might need to better understand the work that we're doing and the impact that we are making.
Melanie, I want to talk briefly about the number of families that you reach is great, but how many do you think you aren't reaching?
Oh, so we know that there's 23,000 children in the New Orleans area under the age of 5. And we know that there are probably about 5,000 that are on a wait list of some sort. COVID is a little bit different because we recognize that the wait list is kind of different this year. So we know that when we open back up again, we will have children that will remain on the wait list. We could probably serve about 5,000 children that are not enrolled in any type of early child care center or program in the city of New Orleans.
And I asked that question just to try to illustrate for the public just how serious and vast this need is. Now, we are touching some lives and we are making some headway, but the fact is we've got a tremendous amount of children out there that don't get benefit of something that we know that is essential, that we know works. And what can we do to help you expand your scope and not specifically, well, specifically training grounds, but not necessarily specifically training grounds, all of the other early childhood education providers? This problem is vast, and there's probably not one entity that can address it all. So what can we do in a holistic manner to try to broaden the scope to make early childhood education more accessible to more families?
I think continuing to support the variety of programs that are out there and continuing to stress the importance of early experiences and that they matter, making certain that families understand the impact that early experiences have on brain science and on brain development. And we can't stress that enough. Just like we did campaigns to talk about back to sleep when it was important to put babies on their back to go to sleep, or the smoking campaigns about the impact of smoking on health, right? We need to be stressing that brain development starts at birth and that we cannot afford to wait until a child is 4 or 5 years old to expose them to quality experiences. And those experiences do not have to take place inside of a center. They should be taking place at home every day through everyday activities that are supported by a ton of different research that is out there.
And see, we can't escape the reality that we do have in way too many instances, parents who don't have that basic skill set or basic knowledge of what they need to be doing because they weren't provided with it. We've got children that have children. So these kinds of programs are essential with broadening the base and trying to get those kinds of opportunities into those homes, because we're going to be like a hamster on a wheel, steady going around, not starting to address these problems at the beginning. And I talked about it and you touched on it, that education is the key to all of these ills, from housing to crime to all of the disparities. If we enable children to be able to learn when they get to school, they will be far more successful, which means their outcomes will be far better. And for me, it's a no-brainer, and that's why I keep pressing this. And I want to thank you for the work that you do, but we cannot lose sight of this. So I want to keep highlighting this because I think it's absolutely critical to the future of our city. Colleagues, I see you joining. Did you have questions? Kristen?
I just want to say thank you so much. It was also wonderful to see you out there this weekend, Ms. Richardson. It was so great. And having this great conversation with you, and then to find out that Jay was going to have you at this committee hearing, I was super, super excited. It just makes so much sense on so many levels. I think your services are needed even more right now with COVID. And I think that underscores the fact that you work with the families in the home. And, you know, this is also, I look at this, I remember as a young mother many, many years ago, but there's also coping skills involved with that too. Knowing how to positively interact with your child. And I just really want to thank you for your work. I told you, and I'll tell you publicly again, that I'm committed to finding you a location in Algiers. And I know Councilmember Wynn needs a location out in the East. And because I also believe transportation is a barrier to a lot of these really well-developed programs. And so I really want to be a partner with that. I know we talked about the Arthur Mundy Center, and I'll definitely, you know, talk with the city folks, and we're exploring that right now on your behalf. But I think that we definitely need to find something that we can have this wonderful resource to us over here in Algiers. So thank you again for your work.
Thank you. And I think that it is important that we talk about the We Play Center is one model that allows parents and children to learn together. Right. Because we have parent educators on the floor modeling, and we have the best ratios, right? Every child's with their caregiver. So if we need to address an issue or help a parent to understand the difference between sharing and taking turns, I can work one-on-one with the parent. And I know that 30 other parents that are watching me, because they want to see how this is going to turn out, right? They want to know, are these strategies and techniques really helpful? And so it allows us to have a peer learning and a group learning, and we all are invested in what's happening to the children in the center.
Yeah, I'm not sure if the public really understands that. I loved when you explained the modeling behavior, how you actually have parents there with their children, you know, showing folks. I just thought that was super important. I mean, that I would have loved to have had that too when I was a young mom. I think that's super important. So thank you for that. And I also think, quite frankly, when we talk about her program, especially Councilmember Banks, and that we really need to talk about the leveraging of smart resources, right? The fact that she can hit so many and touch so many different families all over the city. And I think, you know, we don't have enough money to make sure that everybody has quality early childhood education. And I would be very willing, looking at this year's budget, you know, touch wood, to really talk about that and make sure that we have, you know, we can really support you financially. So thank you.
Thank you.
Councilmember Wynn?
Yeah, thank you, Mr. Chair. So Melanie, I love you guys. I've been very fortunate to interact with the training grounds and the replay before running for office. So this is something that is very natural. And again, Christian, you know, to your comment, it is truly a demonstration, because even as a parent, and I had to discover this as well, when I am put in a location to interact with the triplets, it's extremely overwhelming when you're in a public area, right? And then when you see people modeling it's been a great learning process. And so, and I think Jay, you also indicated, like, we have young people that are raising kids as well. And so many times those are not being modeled for them. And so the We Center, the training grounds really allow you to be who you are. And then it also allows you to be able to see other parents doing things that you may not normally be exposed to. So sometimes I see it as a cross learning. As adults, we don't want to admit to it that when we don't know how to do something, right? We kind of keep it to ourselves. But then if somebody's doing something differently, we're observing, and hopefully we be smart enough to pick it up, to know that, you know, how we could do it better. And so, Mr. Chair, I would want to encourage you to take your grandson to a We Center, and be able to interact. And it's, and you know, one thing I've also walk away when running a well, I call it a PlayStation for a play. I've been out of the field for so long, Melanie. Think a playhouse for us was like teaching parents how to use what resources they have at home to have fun. Because, you know, when you are in a working class family, you're not going to have the resources to have other stuff that other parents have, but also looking at what is around you and making it work. Because I, you know, find myself in that program where now I look at a roll of paper towel differently. You know, once you finish the roll of paper towel, the brown stuff, you can use it to create other stuff you could use to make a horn or cut it up to make all sorts of art activity with the kids instead of throwing it away. And so that's one thing I love about this station is that allowing us to be practical parents, right? And using what's around us. So I agree, Christian, whatever we can do to help, Melanie and Christina, if I win the lottery this weekend, let me tell you, I will fund the city's early childhood needs, because it is so critical, and you on point about that. We got to make sure that we hit them early, because we see it on the other end, and it costs more, not just the cost, but just the frustration for the child, for the family to go with. You can't put a price tag to that. And so again, I'm still playing the lottery. Okay, so Melanie, so I'm not telling you that if I win, I'm playing it. And so but yes, I do support early childhood, and whatever we can do, I definitely want to be there at that space. Thank you, Mr. Chair.
Thank you.
Any other colleagues? Jared, Yes, Jared, Councilman.
Thank you, Councilmember Chair Banks. Melanie, thank you for being with us, and thank you to the chairman for having you on the agenda. I've got to know you for a few years now, and I appreciate, as my colleagues have stated, the work that you continue to do in the children far and wide throughout the city of New Orleans. We wish and we want, and we can work towards having more We Play centers throughout our city, because it is definitely an impact in reaching children early, in especially coming out, cross fingers, this pandemic, the demands on working families. The labor report from December had 140,000 people losing their jobs throughout the country. And predominantly of that 140,000 was women of color, mostly Black women and Hispanic women. With the country that we live in, the richest country on earth, women should not have to choose whether to stay home or the workforce. And the We Play Center offers the opportunity to advance our young babies, girls and boys, to make sure that there is a better quality of life. One of the good things I do see that upon passage, hopefully, of the latest Biden COVID package is the increase in the earned income tax credit for children from $2,000 to $3,000, and for ages under 6, it will go up to $3,600. So I too commit to you that we'll do what we can with funds available to support your thriving center that means so much to us and the children of the city and parents.
Thank you very much. I really appreciate that.
Well, Melanie, again, I want to thank you. And before I let you go, I want to paraphrase. Frederick Douglass said, "It's easier to build strong children than to repair broken men." Well, the 2021 version of that, it is not only easier, it is far less expensive and far better investment for us to spend money on our children early, on education, rather than trying to rehabilitate and spend it on incarceration. And I would hope that I'm very excited to hear all of my colleagues talk about the future and what we hope to be able to do with these city resources. But we also need to be asking the private sector, the tourism interests, the business people. All of this affects everybody. Everybody needs to be looking holistically at what needs to happen to give our children a real path to success, and it starts with early child education. So, Melanie, thank you. We will continue to try to advance this and to try to spread the knowledge. And I commend you all for what you all do. So thank you very much for joining us today.
Thank you guys so much. I really appreciate this. And I look forward to continuing the conversation about how we can support more families through the We Play Center and Training Ground Services.
Thank you, ma'am. We will move. We did not have any public comment on this item, so we will move on with the next item. Let me please introduce Shay Zeller relative to the proposed grass cutting ordinance. Now, we will, after this presentation, ask for a committee vote on this. I do not have any public comment on this one either, so we will proceed with the presentation and then we'll ask for the vote on the ordinance. So Shay, are you with us?
I am, although my computer is not allowing my camera to come on. I apologize. So I think we have a slide presentation. If that's ready to go, I'll take you through that really quick. Okay. So in general, we're just proposing to reduce the violation height for grass and weeds down to 10 inches. If you could go to the next slide, please. Okay, so and this is the only change. We're asking to take it down from 18 inches to 10 inches. This section 26-160 appears in the building code. This is the minimum property maintenance code. So if you can go to the next slide, please. Section 66-312 also pertains to grass and weeds. And earlier, about a few months ago, council approved and the mayor signed an amendment to the ordinance to reduce the height from 18 inches to 10 inches. And this chapter 66 is the nuisance code. Okay, if you could go to the next slide, please. All right, so the purpose of this amendment is obviously to make the height of grass consistent across the building and the nuisance code. It avoids confusion both for code enforcement inspectors and also for the public to just get one consistent message. Grass needs to be at 10 inches or below. It also enables the city to intervene before the height of grass gets too out of hand. And this benefits both our enforcement and it also helps with abatement. So other jurisdictions keep their grass height around, like Jefferson Parish, for example, is 8 inches. We didn't want to go that low, and we're not looking to use this in a punitive way. We're really just trying to avoid those vacant lots that are severely overgrown. So this allows us to get involved before it gets out of hand. Through abatement, we see cost savings if we lower the height. Because our enabling statute only allows us to do maintenance cuts when there is a violation, waiting until the grass gets to 18 inches is not as good because, first of all, it makes the neighborhood look ratty instead of being able to maintain it in a nice way. But also it costs more. You need heavier equipment to be able to go cut 18 inches as opposed to just, 8 to 10 inches. So that's another reason for it as well. Okay, if you could go to the next slide. And just for the sake of context and comparison, I wanted to show you how these two ordinances differ. Chapter 26, the building code, is the code that outlines regulations around your property maintenance, but it is enforced and you go through adjudication through the Chapter 6 adjudication process, which is it's a lengthy process, and it should be a lengthy process because at the end, you possibly stand to lose your property. So I just want to make sure you understand 26 is just laying out the regulation, but it is enforced through Chapter 6. Chapter 66, the ordinance about grass, -312, is both the regulation and the process in which we can enforce. It creates, both the rule and this fast track way to get grass cut and to get the costs added to the tax bill. So, the outcome of these cases, one is sort of light and the other is much more severe when you stand to lose your property. And so that's how they're treated differently. And I think that is all I have for you, but I'm happy to take your questions.
Thank you. Councilmember Nguyen, are you still with us? Or did I lose you?
Yes, sir, I am.
Did you want to go first? Or you wanted me to go?
You can go first, sir.
All right. just for the public's edification, this is a quality of life issue. And we're addressing this because we've got vacant lots that sometimes get to be as tall as I am. And this will give a faster enforcement opportunity to be able to take action to get those lots cut before they get to the really ridiculous states that they sometimes end up in. I know there's plenty of them out there in New Orleans East, but I've got a problem back in Hoffman Triangle and throughout the city. I know that that this is problematic. So I think that this is a good thing that will help improve the quality of life in neighborhoods. And vacant owners of absentee owners, they still have responsibilities, even though they may not be living near or where those properties are. The people that are living there shouldn't have to suffer from their neglect. So this helps us better enforce keeping our neighborhoods livable. And I would ask, if there are no other comments, I'd ask for approval of the ordinance.
I'd love to be added. And
absolutely. Well, we will add Councilmember Palmer.
So Jay, just on your comment, so you know if the grass is taller than you, so you know I'm a midget.
I did not say that. Let the record reflect that I did not refer to my council colleague.
I think it's a very good point, and that's what we're seeing in many of our neighborhoods. So for people to understand, you know, how important it is, and then it's so critical that we change legislation, because you can't make people cut at a certain height if the legislation doesn't reflect that. And so many times I get people, it's like, oh, you know, all you just doing is just changing language, but you got to change language to have that enforcement there. Because if not, then you will get grass as tall as Jay, you know, exists in neighborhoods. And this is one measure of us addressing it. Once this is done, then there's at least the administration can have that enforcement. Until then, people can keep complaining about how tall it is, but until we change that, it's not going to get there. So I really appreciate the administration for working with us and understanding the needs in our community and providing this this language, so that way we can address the nuisance in our community.
Can I also add something, Council Chairman?
Go ahead, Ms. Palmer.
Is that, you know, we also have blighted lots and vacant lots in my district as well, especially in Algiers. And, you know, the taller the grass is, the more it also encourages dumping on these lots. And you could go down, you know, some of our streets, and it's obvious that the people that keep their lots very clean, well cut, they're not having dumping. But two doors down, if there's a vacant lot that's not well kept, that's not cut, you have dumping. And so I think that's a whole nother issue that this is going to also help, is to prevent that kind of dumping that you see on overgrown lots. So thank you.
Colleagues, if there are no other questions, I will move for adoption of the ordinance. Can I get a second?
Second.
Council, roll call, please, Paul.
Councilmember Banks,
Yay.
Councilmember Nguyen,
Yay.
Councilmember Moreno,
Yay.
Councilmember Giselson Palmer,
Yay.
Councilmember Brosette. 4 votes in favor. It's a favorable recommendation.
Thank you, sir. And we did not have any public comment on that. So we're moving on to our last agenda item. And this will be, the presenter is Fabian Blanche III. Fabian is the executive director of the State Board of Private Security Adjusters. And we asked him to come. This goes back to a situation that took place up in District B, where it was brought to light about a private security guard who acted in a very unprofessional manner with a 12-year-old child. And it brought to light multiple questions as to the authority and the power, and what do these privately funded security details, what can they do, who do they answer to, and exactly how do they work? Because they are charged with security, and they're riding the streets of the city. we didn't really have a lot of answers as to how this actually functions. So we asked Fabian to come and explain it to us. So with that, Mr. Blanche, welcome.
Thank you. Appreciate it very much. Thank you for having me. Thank you, President Moreno, for having me as well. I'm going to start a screen share here, if you don't mind, so that I can put some information up to you. Let me know if this is broadcasting. Can you see this?
Yes, we got you.
Thank you very much. So my name is Fabian Blanche III. I'm the Executive Director and Chief Administrator of the State Board. As Councilman Banks has mentioned, I wanted to kind of unpack some information for you folks. This is a long-standing conversation and series of questions that we've received over the years. I've been here since 2016. So I want you to kind of understand where our agency rests, first of all, and talk about our statutory authority. So the Department of Public Safety and Corrections is where the state police is located. Under the state police, there are two entities. There's also the fire marshal is listed with DPSC as well, but there's the Louisiana State Board of Private Investigative Examiners, which deals with PIs that conduct investigations. Those are licensed individuals and companies. And then there's the State Board of Private Security Examiners, which is my agency. The legislation that we function under is found in the Louisiana Revised Statutes under Title 37. It's on your screen. The things that we deal with as regulators of this industry touch upon the bullets that you see on the screen there. I'm not going to read them to you. You can see them for yourself, but I just wanted you to have some quick reference point in the packet as to what it is that we deal with and how we go about doing what we do. Now, I wanted to talk immediately about the difference between two terms that are frequently bandied about in this industry. One is private security and the other is proprietary. So the State Board of Private Security Examiners licenses companies that engage in contractual security services, whether that's a written contract or otherwise, to an end user. They provide that service. So for example, with proprietary security, if Dillard's hires an employee as a cashier, decides to promote them to loss prevention, which is a security function in effect because they're looking for and deterring theft. If that employee is an employee of Dillard's directly and they receive their paycheck from Dillard's corporate, that is a proprietary security function. We do not regulate that. But if the company hires a company to come in and provide security, i.e. L&R at a Saints game, Landmark, things like that, festivals, events, carnival, you name it. When you bring people in on a contractual basis or you're paying them to provide the service, do the scheduling, take care of all the insurance requirements, training requirements, et cetera, that's private contract security. That's what we regulate. It touches the industries listed at the bottom of this slide. So you see I have armored there, that's cash in transit or armored car services, executive protection, retail, facility security, event security, and even set protection, which we have a lot of work in New Orleans in that area as well. Now, what are some of the commonly broken laws and rules? This is where we start getting into some of the behaviors that you see out there that pop questions like the one that you have with respect to the incident with the 12-year-old. So the first and most obvious one would be not having a license to begin with. There is a distinct difference between the way Louisiana, and I'll use Nevada as a companion to us, as opposed to, say, Florida and Texas handles this. Licenses are only issued in Louisiana and Nevada to companies. So the company entity gets the license. The company entity, to get the license, has to go through a variety of different things, including testing. And the final thing that they have to do once the license can be issued is they have to provide liability insurance and workers' comp policies. That and those policies, very much like what you do in New Orleans, must list Louisiana and the state board as additional insureds to isolate us from any liability for what they do with their license and with their company. Security officers in Louisiana and Nevada, unlike Florida, for example, are not licensed. They are registered to the company's license. Now that can sound a little vague or very similar, or a little tricky, but I have a quick analogy that I like to use to explain it so that you understand the fundamental difference between Florida's licensed officer who can go to work for any company at any time and a Louisiana or Nevada registered guard and how that works. If I was going to stay in a hotel in New Orleans and I wanted to stay at two of them on the same day, I'd have to go to two registration desks and get 2 keys, my registration card in effect, to access that hotel and those doors. And those keys are only good for the time period that I've registered for. That's what a registration is in this industry in Louisiana. The guard registers to work with the company, and only while they are with that company are they considered to be a registered security officer. Once their termination is submitted or they separate from employment, that registration, whether it's as an unarmed security officer or an armed security officer, is rescinded, and they would have to then re-register with another company. That also means that they could be with 2 or 3 companies at one time. They would have to have a registration card issued for each. So that's the distinction between the security officer's registration versus a state where they actually issue a license. There's certifications that are also required in some instances. The best example of that would be someone who's going to carry a firearm. So if they're going to carry a firearm, there's a course of fire and a training class that's in addition to and above the 16 hours of training they're required to get as unarmed guards. And that then becomes a certification for a 1-year period of time. And that certification has to be renewed every year. So if a security officer is working on a post and has a gun, they must be certified. If they're not certified, it's a violation of the statute. The other things that we frequently see are insurance lapses, or where they have no longer have insurance, where they don't train the officers. One of the things that the law allows for in many states, including ours, is allowing people to work in an unarmed capacity. But while they're working in an unarmed capacity, they have 30 days to get their first 8 hours of training. And then subsequent to that, at 61 days, they have to have their second 8 hours of training. If they don't work beyond 30 days, they don't have to do it. If they don't work beyond 61 days, they don't have to have both classes. But nevertheless, we have lots of people working in the industry who've been working well beyond 61 days that don't have the training. So that's another thing that we run into as a commonly broken law or rule. Out of uniform is another one. This is extremely common. The state board's laws and rules require that upon application, a company must submit to the board renderings and pictures of the uniforms and how they will be used. And they have to be approved by me directly before they can use them. Nevertheless, people will freelance and go out and buy other uniforms, different colors, change badges, patches, skins for their vehicles, whatever the case may be. They'll be out of compliance for that as well. Unauthorized weapon comes about in multiple ways. There's certain weapons that are allowed. I'm not going to talk about the long arms just yet, but when it comes to handguns, it's the normal things. It's 38, 357, 9mm, 45, and 40 caliber. People who carry 357s can only use 38 ammo in the guns. That's the way the law is written. But what makes a weapon unauthorized would be not having a certification. It would be unauthorized. It being a weapon other than those would be unauthorized. And if they're not registered, even though they may have taken a certification class and passed it, if they don't have a registration, they're not authorized to work and they're not authorized to carry that weapon. And then there's the other issue at the bottom I have listed, which is plain clothes without authorization. We get this a lot in the New Orleans area because people work in hotels and other hospitality areas. There's an opportunity for them to work plain clothes. All they have to do is request it in writing and get it approved by me. Oftentimes that doesn't happen, so we run into that as a violation as well. Some other concerns are alcohol beverage establishments using AR-15s and shotguns without authorization from me directly here at the board. And then I want to briefly touch upon these 2 important distinctions, and that's open carry and concealed carry. So one of the retorts that you'll get when enforcement people are out and asking questions is, well, this is an open carry state. It's open carry for civilians, not for people working in the course and scope of employment. That is not what open carry is for. The moment you hire the gun out in a security capacity or otherwise, it's regulated and that does not apply. Same thing goes with concealed carry. Concealed carry is another civilian type of licensure that is not to be used in the course and scope of employment. There's nothing in the state law that allows for a person to have a concealed carry permit and then work security without being licensed by the state board. LEO inspections, I put that down there just to touch upon this quickly, law enforcement officer inspections. Any law enforcement officer in the state of Louisiana by statute under Title 37 is authorized and allowed to request any security person or company owner to produce their license and or their registration card. That is at any time, and they must furnish it. If they don't, that's a violation of the laws and the rules. And we've kind of implemented something along the lines of this in a few places. Baton Rouge is one. We've met and talked with Chief Ferguson about it last year in New Orleans, and that's Operation Forge Alliance. The concept behind that is simply to let officers know that they can inspect security guards, even though they don't work for this agency, because the law allows them to do so. And if they find that they have a card, that's great, no problem. If they find that they don't have a card, they're encouraged to either send an email, a text message, make a phone call, notify us, and just say, hey, we were out here doing whatever we were doing from an inspection or enforcement perspective. We came across a security officer who was armed. We asked for his registration card and he didn't furnish one, and we'll pick it up from there. I wanted to make you aware that the State Board's website, which is lsbpse.com, it'll appear at the end of the slide presentation, has a public lookup feature. You do not have to be registered to this site. Anyone in the entire world can access this 24 hours a day, and it allows you to choose lookup on the screen where you can put in a person's name, and you will find out whether or not possibly they are denied by the board to work. So if they're standing on a post somewhere and someone asks them for a card and they furnish the card, you can look this up and find out if the company license is good or not. This is a guard registration lookup. The next one is a company lookup. This is a company in New Orleans that was issued a cease and desist about 3 years ago and worked without insurance and a license and had a shooting in Algiers where an individual who was working for them was armed on post, shot in the face, and turned out to be a convicted felon. So I use these as great examples of how powerful this lookup is, because it will let you know that that license is revoked, and it gives you all sorts of indications on the screen as to what's going on with the status of that credential. What I wanted to touch upon is specifically on the tail end of this is the difference between off-duty versus extra-duty work, because the scenario that Councilman Banks talks about involves an individual who was in a law enforcement capacity in his full-time capacity, but working in a security capacity at the time of the incident. There's a distinct difference from my perspective between off-duty and extra-duty. I've been a police officer since 1985. I came out of New York City. My parents are from the 9th and 7th Ward, but I was born and raised in the Bronx. So I've worked in law enforcement. I'm still commissioned here in Baton Rouge as well. And the distinction between these two things is that extra-duty would indicate to me that the department is deeply involved in posting the officer at the location to perform the work. And there is an understanding and an acceptance between the department, its police, jury, city council, or otherwise, that the work that that officer is doing is still in a law enforcement capacity and is indemnified by insurance, self-insured fund, whatever the case may be, should there be anything that results in litigation as a result of some actions they take. Off-duty work, I think, is distinctly different. Off-duty means, okay, I am a commissioned law enforcement officer. I'm working for someone somewhere in a security capacity, but I'm doing this not necessarily directly through my department, but just on my own time. And in that case, I think this is where things get a little strange, because for someone to work in an off-duty capacity, from my perspective as a regulator and a police officer, I would think that they would have to either have an insurance policy to cover themselves if they don't have an express declaration from their agency of origin saying that they will cover any activities that they engage in while they are off duty and working security. Or in the best case scenario, they would actually register themselves like anyone else with a licensed security company and work as a security officer. And the reason for that is this: the legal authority of a security officer in Louisiana is that of a private citizen, not that of a law enforcement officer. And the policies that I mentioned at the top of my presentation that the companies must get to get the license, those policies cover security companies and a level of authority of a private citizen. Those policies do not cover police activity. So in the case that Mr. Banks is talking about, there are some questions and some lingering concerns around that. But ultimately, when a neighborhood association, for example, is looking to secure their neighborhood and have patrols, The best case scenario for them is to either engage a licensed security company, have that company furnish security officers who are armed and their patrol cars, do that on a contractual basis, insulating themselves under the license and the insurance policies, or dealing directly with a law enforcement agency who has given express written consent and authority to not only post a law enforcement officer in an extra duty capacity in that role, but also furnish the board with proof that should something arise from that activity, that it will be covered by the Department of Hire. So I'll open it up to questions.
Fabian, thank you. I've got several questions because I appreciate your being here and thank you for that. But I've got to ask questions in a basic way so I can try to understand them. Are these privately hired security officers considered law enforcement?
No.
Okay. So what is it if a private security officer is on the street? What is he empowered to do?
So I'm going to pull up and see if I can get this on screen for you. Let me know if you can see this. Can you see my document?
I see. Thank you. That's what's up. The last page of the slideshow.
Let me stop the share and start a new share, so I get the right screen on for you. Because I want to talk through this with you. Here we go. All right, you should be able to see this now.
Yeah, it's up now.
So this is the statutory definition for purposes of our regulation of what a security officer is and a general idea of what they do, okay, right here. You'll notice, for example, that it says under H, control, regulation, or direction of the flow of movements of the public except on public streets, whether by vehicle, on foot, or otherwise. And then in I, it says street patrol service or merchant patrol service, which is any contract security company that utilizes foot, motor, or any other means of transportation in public areas or on public thoroughfares. What that does not allow them to do is conduct car stops. So they don't have the right to just stop a vehicle like a police officer would, pull it over, detain someone. They can't do that. They cannot use red and blue lights on their vehicle in a security officer's licensed security company capacity. And therefore, once you take out the car stop, using the scenario in question, you mitigate all the other activity that happens. You don't have the car stop, you don't have the questioning, you don't have the detention, you don't wind up with the gun drawn on kids. Very different between what a security officer can do, as I said, with the level of authority of a private citizen versus what a police officer can do. Totally different statutory authority and power.
So an individual walking down X street, a private security person does not have the authority to stop him and question him about where he's going and what he's doing. He's walking down the sidewalk.
They're supposed to observe, document, and report facts and notify law enforcement if they have a concern. If they're inside of an establishment, there's some different criteria there.
Get that. I'm talking specifically, right. Get on the sidewalk.
Yeah, no, they're not empowered to stop, question, and frisk, or stop, question, and detain in the manner that a law enforcement officer is able to do so. Now, if they are witnessing an egregious felony in their presence and there's an exigent need to stop someone from fleeing a crime scene, that's a different articulable scenario. But just the idea of they're standing on the street corner outside of the Astor Hotel on Canal and somebody walks by and they want to stop and question them about where they're going, no, they can't.
And you talked about the training, the gun training that the private officers have to go through. What does that entail compared to what police officers or sheriffs or government authorized gun people do?
Getting down to the actual the course of fire and the components of the training, they're very similar. Post, which is through LCLE, regulates police officer firearms training. And that's standardized across all 50 states. The course of fire that security officers take is similar. Some of the instruction is very similar. But again, there's a big gap between the legal authorities and the use of force capabilities that they have. Ultimately, law enforcement officers in a real post academy that go not only through an academy to become qualified as police officers and then subsequently train with their firearm, there's a big disparity between what happens in the academy versus what a security officer goes through. They get 8 hours of firearms training where they do a class, safety class, shoot a course of fire, and demonstrate proficiency. Police officers get multiple days. There's a lot of law that's taught in conjunction with it, and they go into it in a much deeper way.
But the guns and the bullets are the same, but there's definitely.
Absolutely. So the potential exposure with respect to the use of the weapon, there's absolutely no difference, which is why I kind of harped on for a brief moment the distinction between the insurance that the companies have, what it covers, and then the difference between law enforcement. You know, these private companies are relying on policies that they pay for, whereas in many cases in municipalities, law enforcement agencies are relying on, you know, a different mitigation construct, whether it's a self-insured fund or whatever the case may be. The training is a bit more extensive. It's sometimes more frequent. And I just find that there's a distinct difference between the two. But when you put two human beings in a uniform anywhere where they're interacting with the public, there are some similarities to how you get to that escalation of force, where you get to the point where you're drawing a weapon on the person.
And in the case where there is an off-duty officer of whatever agency who is working for the private security company, if something happens, who's got the liability? Is it the public agency, or is it the private company or the private neighborhood association?
That's a great question. That's a great question. So in my estimation, when you're posting an officer in some sort of an extra duty capacity or whatever they want to call it, and that officer is in uniform and possibly even using a department vehicle, the agency of origin is going to be ultimately responsible for it, and whoever their authority comes from as well. So if it's a municipal agency, it's going to be the agency in the city. If it's a parish agency, it'll be the agency and the parish.
But if he's not in the public car, if he is the ABC officer for the XYZ agency and he's working for the neighborhood association and something happens, he's in his private car or their vehicle or whatever, but not his work car, who has the liability at that point? Because this incident happened with a commissioned officer, but he was not in the agency vehicle.
Yeah, right. His authority comes from the agency if he is identifying himself as a police officer. So in the moment he activates that Leo level of authority, that it becomes an agency matter, because you're taking a law enforcement action.
So the public agencies really need to be intentional on monitoring and watching and be aware of what their employees are doing, because the liability will ultimately come back to them. And
absolutely
things happen with this kid, but that could have gone horribly wrong. Something could have gone way bad with that.
No question.
Conversation.
No question. And in the perfect world, like I mentioned to you, these people, whoever these end users are, would better serve themselves and insulate themselves from potential exposure by using licensed contract security companies, because those people have the license, they have the state legal authority with the license, they have the security officers, they have the training, they have the insurance policies, and they can patrol neighborhoods. They can do all the things that they want to do, create the omnipresence, let people know that there's somebody watching. It achieves the same objective without that extra layer of intrusion. And I think it's just, in my personal opinion, doing this now since '85, but working here specifically for the last 5 years, it just seems to be the most logical and safest approach, where you don't get an overstep or an overreach in the manner that you incurred on that day.
And to your knowledge, does this come under if a officer of an agency takes one of these gigs? Does that come under the Office of Secondary Employment with the police office, with the NOPD, or is that a whole separate private deal? Where's the oversight?
Well, that's where the problem comes in. So in the case of New Orleans, if things are still in the state that I was aware of a couple of years ago, with the consent decree and the oversight from that, New Orleans is forcing their officers to go through private contract security companies as registered security people to function off duty. Now, extra duty, that's where I made that distinction, is different. That oversight should be coming from the department if the department is the one that is actually issuing the post orders and putting those officers in those extra duty capacities beyond their normal 40-hour work week. Ron Crouch, who's behind me, who's our state board general counsel, made a sage comment in my ear just a minute ago. He said, ultimately, the plaintiffs are always going to go after whoever has the deepest pockets, right? Which is why it's so important to have clear lines of demarcation along the way so that when lawsuits are filed and people get served, there's ways to remove yourself from contention in those litigations and insulate yourselves from that. These departments have played, and I'm saying this, as someone who's worked in law enforcement, as I said, since '85, sheriff's offices, constables' offices, justices of the peace, you name it, municipal police departments, they've all have different constructs. We have 64 sheriffs, we have 300 and some odd, 18 some odd police agencies in the state. They're all different. Some don't. Some have internal policies that don't even allow their people to work extra duty details. Some have policies that allow them to work anything they want in uniform with the take-home car. Some of them, they have to get express written consent, and they only allow them to work certain types of details. And then in the case of cities, not New Orleans in this case, but in many others, the departments, some of them, the chiefs are appointed and some are elected. So there's such a menagerie of law enforcement agencies and constructs in Louisiana that it makes it very difficult to often ferret out who ultimately is going to hold the responsibility without doing a deep dive into the internal policies, what you can and cannot do, why were you there, who hired you, who authorized it in your chain of command, and going up the flagpole that way.
And then just a couple more questions.
Sure.
Is there a registry or a way to be able to know that if a person who was terminated from a law enforcement agency for some reason, he goes to one of these private firms, he got terminated from a government agency for some misdeed, but he's still carrying a gun in a private agency. Is there some way is there a registry? Is there some way to check? Is there some prohibition against that?
There's no registry, but there is some way to check. Let me explain to you what happens in that case, because we see this a lot. Obviously, the logical next step for a terminated or disgraced police officer is to go into the private security industry. That's the first thing that they think of. What happens is when people apply for licenses, or when they're going to companies that are already established and they're applying for registrations, we conduct background checks on these individuals. And there's a variety of questions that they not only have to answer, but we run the fingerprint backgrounds as well. When they furnish the information about their previous employment and we see that they used to work in a law enforcement capacity, one of the things that they have to sign that's a part of the process is a information waiver form. And what we do is we reach out to the agencies and ask them for details about what resulted in the separation. Sometimes we run into some hiccups and barriers with that, but they're easily, they're easily surmounted by the fact that we have subpoena authority. So whether we get the answer directly from their HR department and they say, hey, look, this is what went on, this is why the person resigned to avoid termination, or was terminated, or was let go during probation, or whether or not we have to subpoena the information, we have ways to know what resulted in the separation. And we have to factor all of those things into our decision, whether or not to give them a company license and or to give them a registration to function as a security officer. Now, I can't speak, to the history going back to '85 with the agency, but I can tell you from a statistical standpoint, we have about 3,600 individuals in the last 2.5 years since middle of 2018 that we have denied registrations and or licenses from, which is a pretty significant rate compared to what I was able to find when I first got here. And that's because we rely on the part of this statute called 3276.1, which I'll pull up. We use this very rigorously because it talks extensively in this section here about people being of good moral character, honesty, integrity, but it even goes into their reputations, their habits, their associations, etc. We look at this stuff when it's a form of Leo every single time. It's very important to us. We don't want them to look at this industry as the place that they can perch up and go back to doing nefarious things or doing the wrong thing. It's a headache for us. It's a danger to the public, and it doesn't, serve the mandate. So that's how we address it. We don't have a central repository for Leos specifically that we can access or that we keep to say this person was a law enforcement officer and they lost their job or were denied. But the process works, and I think there's good rigor to it.
And then my final question, if a officer is terminated or released or removed or resigned or whatever, does he maintain his post-certification that can bring that to another agency?
Typically, the answer to that question would be no. Now, there's a confusion that exists, again, in the law enforcement industry and to the public, obviously, when you say post-certification, because there's two types of post-certification. One is that you went to a school and became a post-certified police officer, right? That's an educational achievement, right? And then the other is your annual qualification with your firearms, which is also a post-certification. So you don't lose your degree as a doctor because you lost your license as a doctor, but you can't practice, right? And if you don't renew your boards and your certifications, the ones you have to maintain with CLE, CEUs, or whatever the case may be, then you can't do those things. So the answer to your question is, if I'm a post-certified cop and I get fired, I still have a post-certification. I could theoretically go to another state, potentially get hired and not have to go back through an academy because I'm post-certified. But the firearms piece is an annual requalification, and that is also considered a post-certification, but that's specifically for use of the weapon.
Okay. Fabian, thank you. Colleagues, do you have any questions? Well, Fabian, I really appreciate you taking the time to be here. This situation came up out of something that could have been horribly more tragic than what it was. And it brings to mind a tremendous amount of questions because I think it's something that most people were not aware of. Even the folks that have these private security districts, I don't think were fully aware of their potential liability and their potential entanglement if something goes horribly wrong. So I appreciate you being here, and we will continue discussion because we need to make sure that the folks who are involved in this fully understand what their responsibilities are, what their liabilities might be. Now, I think it's great that folks can do this stuff, but they have to do it within full knowledge of what's on the table when they are doing it. So I really thank you for taking time and appreciate it.
Thank you. Thank you.
All right. We had one public comment on this, and we will read that public comment.
Yes, sir. There is one public comment. Can y'all hear me? From Lucy Bloomberg. She is not a paid representative. As a resident of Mid-City, I pay taxes that I did not vote for to fund the Mid-City Tax Security District. We don't need more security patrols to create safety in our neighborhoods. The safest neighborhoods are those with the most resources. I urge City Council to devote time and money to investigating proactive measures that actually reduce crime and increase safety, such as affordable housing, a livable wage, dignified jobs, and better schools, as they do to jails, policing, and prisons. That's conclusion of public comment.
Thank you. And with that, colleagues, if you have any other business, we will entertain it. If not, I will gladly entertain a motion to adjourn. And it
So
looks-
moved.
Second, thank you, Cindy. Do we have enough to have a vote? Well, with that, I will wish you all a safe rest of your week. Please continue to take the protocols necessary to keep us all safe. Wear a mask, wash your hands, and social distance. And as soon as you are available, it is available to you, please go and get a vaccine. It's imperative that we all do that. So with that, thank you all, and we stand adjourned.